at a grim milestone when it comes to measles. Last week, the CDC released data revealing there have now been more cases this year than in any other year since the contagious virus was declared eliminated in the U.S. 25 years ago. So what is going on right now? So glad to have Emory's Dr. Winawer here to break things down. It's great to see you. Good morning.
Likewise, Paul.
But this is startling. I mean, I told you when I heard a couple of weeks ago somebody started talking about measles, and we just don't hear about that anymore. So when you hear these numbers, almost 1,300 cases, what are you thinking?
I think it's a failure of public health. It's a red flag. You know, measles is so contagious. It's one of the most contagious diseases out there. It's like a canary in the coal mine for potentially other diseases like whooping cough and polio and meningitis.
Wow.
Vaccine-preventable diseases that we've practically eliminated from the society. This is opening up the door for them coming back as well.
Yeah. So you're talking about most of these cases are in the unvaccinated population. So right now, I mean, do we know what percentage of young kids, like kindergarten age, are getting these vaccines?
Yeah, about 92.5%. And the CDC says that 95% is the magic number for the concept of herd immunity, that when you vaccinate enough people in society, they protect others as well. We haven't been at 95% or close to it in the last 5 years, and each year it's gone down. Last year it was 92.7, and this year is 92.5, and that might not seem like a bigger difference, but you times that percentage by the thousands of kids, that there are thousands more kids now that are unvaccinated when they should be. So the trend is what's concerning. We need to get those numbers back up closer to 95%.
And so what does this mean for elimination status? Because that's a specific designation that's given based on like population and percentages, right?
100%.
Yeah.
Well, there are not going to be any travel restrictions or anything austere like that, but it's more like an embarrassment in this country. You know, 25 years, and with all our resources and finances, this should not be happening in the U.S. And besides it being embarrassing, it's a symbol of the over-politicization of vaccines when this should be a scientific fact. And that's really, it's more of a symbol than anything when you lose your status like that.
Well, let's keep talking about vaccines for a minute, because I know a lot of people will have questions for you. So Andrew Nixon, who's the spokesperson for the Department of Health and Human Services, wrote that the CDC continues to recommend vaccine as the best way to protect against the measles, but he does call it a personal decision. So what do you think of that?
Yeah, isn't that funny? You say that it's the best way.
But personal, so it's a little bit of a mixed...
Well, this gets to the heart of the issue.
Yeah.
Vaccination is more of a communal responsibility. I'm going to protect myself, and you're going to protect yourself, and together we're going to hold hands and protect the most vulnerable in society. We're going to protect the infants who can't get vaccinated yet. We're going to protect the elderly. We're going to protect others, and that will stop the spread. I mean, I think vaccination it's been a victim of its own success, in the sense that people forget. You ask old-timers what it was like when half the childhood deaths in the U.S. were related to measles. Or people were walking with crutches from polio. They don't remember, and I think that's the problem. Unfortunately, I think we're going to be going through some of these outbreaks before people realize that we need to get our vaccination numbers back up.
Yeah, I mean, you go into the CDC museum, they have a little museum exhibit, and you see like an iron lung, and you know things were very different at one point, and scary to think it could be going back.
100%. The pendulum is shifting back towards more disease, and it's just a reminder for people to stay vigilant and to protect yourself and to protect others out there. So I think it's very important, like you were talking about school starting too. It's a it's a good time to discuss this topic, and plus we're only in August and we've reached those numbers, so
halfway through the year.
So it's scary to even think about that these numbers surely will go up further and further.
All right, well, we know you'll be tracking it. You'll be back to talk about it. Dr. Winawer, great to see you. Thank you.